Oxygen therapy is a crucial medical intervention that involves delivering supplemental oxygen to individuals experiencing low blood oxygen levels. Our bodies need a constant supply of oxygen to function properly. When we breathe, our lungs take in oxygen, which is then carried throughout the body by red blood cells. When our blood oxygen levels drop, it can lead to serious health problems. Oxygen therapy is used to treat a wide range of conditions, including respiratory illnesses like pneumonia, chronic obstructive pulmonary disease, and asthma. It's also used in emergency situations such as heart attacks, strokes, and severe trauma. The goal of oxygen therapy is to increase the amount of oxygen in the patient's blood, improving their breathing and overall well-being. The benefits of oxygen therapy are numerous. It can help to relieve shortness of breath, reduce the workload on the heart, and improve mental alertness. By increasing the supply of oxygen to vital organs, oxygen therapy can prevent further complications and improve the patient's chances of recovery. However, it's important to remember that oxygen therapy should only be administered under the guidance of a healthcare professional. Improper use of oxygen can be dangerous and may even worsen certain medical conditions. Always consult with a doctor to determine the appropriate oxygen flow rate, delivery method, and duration of therapy for each individual patient. Before beginning oxygen therapy, it's essential to have all the necessary supplies readily available. This preparation is crucial for ensuring that the therapy session goes smoothly and efficiently. This ensures a smooth and efficient process, allowing you to focus on providing optimal care to the patient. When everything is in place, you can avoid unnecessary interruptions and concentrate on the patient's needs. Having everything organized and within reach minimizes the risk of errors and delays. Proper organization not only saves time, but also enhances the overall safety and effectiveness of the therapy. The first step is to gather the oxygen source, which could be a portable oxygen cylinder, a liquid oxygen system, or a wall outlet connected to a centralized oxygen supply. Each type of oxygen source has its own set of protocols and handling procedures. Make sure the oxygen source has an adequate supply of oxygen and is functioning properly. Regular checks and maintenance of the oxygen source are essential to ensure it is ready for use at any time. Next, you'll need an oxygen delivery device. These devices are designed to deliver oxygen to the patient in the most efficient manner possible. There are various types available, including nasal cannulas, oxygen masks, and non-rebreather masks. Each device is suited for different levels of oxygen delivery and patient comfort. The choice of device depends on the patient's condition and the amount of oxygen required. For instance, nasal cannulas are often used for lower oxygen needs, while non-rebreather masks are used for higher oxygen concentrations. Each device has its own advantages and disadvantages, so it's crucial to select the most appropriate one. Understanding the specific needs of the patient will guide you in making the best choice. In addition to the oxygen source and delivery device, you'll also need oxygen tubing to connect the two. The tubing acts as a conduit, ensuring the oxygen flows smoothly from the source to the patient. The tubing should be the correct length to reach the patient comfortably without any tension. Proper length ensures that the patient can move freely without dislodging the tubing. It's important to check the tubing for any cracks or kinks, as these can obstruct the flow of oxygen. Regular inspection of the tubing helps in maintaining a consistent and reliable oxygen supply. Lastly, it's crucial to have a pulse oximeter on hand. This device is essential for monitoring the patient's oxygen levels in real time. This device measures the oxygen saturation level in the patient's blood, providing valuable information about their respiratory status. Continuous monitoring helps in making timely adjustments to the oxygen therapy. By monitoring the patient's oxygen saturation levels, you can adjust the oxygen flow rate as needed to ensure they are receiving the appropriate amount of oxygen. This ensures that the patient remains stable and receives the best possible care throughout the therapy session. Patient safety and comfort are paramount when administering oxygen therapy. This is not just about the technical aspects, but also about creating a holistic environment that promotes healing and well-being. Taking the time to create a safe and comfortable environment for the patient can significantly impact their overall experience and well-being. This involves meticulous attention to detail, from the cleanliness of the room to the arrangement of the bed. Remember, even small gestures can make a big difference. A warm smile, a gentle touch, or a few kind words can go a long way in making the patient feel cared for and valued. Begin by ensuring the patient's room is well ventilated. Fresh air can help in maintaining a comfortable atmosphere and can also aid in the patient's breathing. Oxygen is flammable, so it's crucial to eliminate any potential sources of ignition, such as open flames, smoking materials, and electrical sparks. This step is vital to prevent any accidents and ensure a safe environment. Make sure all electrical equipment in the room is in good working order and properly grounded. Faulty equipment can pose a risk, so regular checks are essential. Next, position the patient comfortably, either sitting upright or lying down, depending on their condition. Proper positioning can help in better oxygen delivery and overall comfort. Use pillows and blankets to provide support and warmth as needed. These small adjustments can make a significant difference in the patient's comfort level. A comfortable patient is more likely to relax and breathe easily, optimizing the effectiveness of the oxygen therapy. Comfort can directly influence the patient's ability to recover and respond to treatment. It's also essential to explain the procedure to the patient in clear and simple terms. Understanding what is happening can reduce anxiety and help the patient cooperate better. Let them know what to expect and encourage them to ask any questions they may have. Open communication builds trust and helps in addressing any concerns promptly. By addressing their concerns and providing reassurance, you can help to alleviate any anxiety or fear they may be experiencing. Emotional support is as crucial as physical care. Finally, regularly check on the patient throughout the therapy to ensure their comfort and safety. Continuous monitoring allows for timely interventions if any issues arise. Monitor their vital signs, observe their breathing patterns, and address any discomfort or concerns they may have promptly. This vigilance ensures that the therapy is effective and the patient remains stable. By being attentive and responsive to their needs, you can create a positive and reassuring experience for the patient. Your dedication and care can make a significant difference in their recovery journey. Section 4. Verifying the prescription and patient identification. Before initiating any medical treatment, including oxygen therapy, it is crucial to verify the patient's identity and confirm the prescription details. This step is the foundation of patient safety and helps in preventing potential errors that could have serious consequences. This step is essential to ensure patient safety and prevent potential errors. Mistakes in patient identification or prescription details can lead to incorrect treatments, which can be harmful or even life-threatening. Start by confirming the patient's identity using two identifiers, such as their full name and date of birth. This practice is a standard procedure in healthcare settings to ensure that the right patient receives the right treatment. This information should be cross-checked against the patient's wristband or medical record. Double-checking these details helps to eliminate any chance of misidentification. Verifying the patient's identity is crucial to avoid administering medication or treatment to the wrong person. This step is particularly important in busy healthcare environments where multiple patients are being treated simultaneously. Once the patient's identity is confirmed, carefully review the oxygen therapy prescription provided by the healthcare provider. This includes checking all the details to ensure they match the patient's needs. The prescription should include the patient's name, the date and time the prescription was written, the prescribed oxygen flow rate, the method of oxygen delivery, and the duration of therapy. Each of these elements is critical for the accurate administration of oxygen therapy. Pay close attention to the prescribed oxygen flow rate, as administering an incorrect flow rate can have adverse effects. The flow rate must be tailored to the patient's specific condition and needs. The flow rate is typically measured in liters per minute, or L-min, and should be adjusted based on the patient's condition and oxygen saturation levels. Regular monitoring and adjustments are necessary to ensure optimal patient outcomes. Finally, document the verification process in the patient's medical record. Accurate documentation is essential for maintaining a clear and complete medical history. Include the date and time of verification, your initials, and any discrepancies or clarifications made with the healthcare provider. This ensures that there is a clear record of the verification process and any actions taken. By diligently verifying the prescription and patient identification, healthcare professionals can minimize the risk of errors and ensure the safe and effective administration of oxygen therapy. This thorough approach is vital for patient safety and the overall quality of care. Section 5. Assessment, the foundation of safe oxygen administration. Before administering oxygen therapy, a thorough assessment of the patient's respiratory status is essential. This assessment provides valuable information about the patient's current condition and guides the appropriate course of action. Begin by observing the patient's general appearance, noting their level of consciousness, skin color, and any signs of respiratory distress. Are they alert and responsive, or do they appear drowsy or confused? Is their skin pink and healthy, or does it have a bluish tinge indicating cyanosis? Next, assess the patient's breathing pattern. Observe their respiratory rate, depth, and effort. Are they breathing rapidly or shallowly? Is their breathing labored or noisy? These observations can provide clues about the severity of their respiratory compromise. Auscultate the patient's lungs using a stethoscope to listen for any abnormal breath sounds. Crackles, wheezes, or diminished breath sounds can indicate underlying respiratory conditions that may require further investigation and treatment. Finally, measure the patient's oxygen saturation levels using a pulse oximeter. This non-invasive device measures the percentage of hemoglobin in the blood that is saturated with oxygen. A normal oxygen saturation level is typically between 95% and 100%. The information gathered during the respiratory assessment helps determine the need for oxygen therapy, the appropriate oxygen flow rate, and the most suitable oxygen delivery device.